Whether you already live with a cat or are thinking of adopting one into your family, it's important to know the basic care needs of these animals, as well as being aware of any possible health problems they may develop. Like any living being, cats can suffer from a number of various pathologies, some more serious than others. This is why, in this Animal-Wise video, we're going to bring you the 10 most common diseases and other health problems in cats. Let's get started. This is a viral disease caused by an onconovirus, the word for a virus which can cause cancer. It is transmitted through contact with bodily fluids such as saliva, blood, urine, or even lactation during pregnancy. The virus affects a cat's white blood cells, which are part of their immune system. This lowers a cat's natural defenses and makes it more at risk of infection and other complications. It is one of the most serious feline diseases due to the ease of transmission and the potentially fatal damage it causes to the body. The symptoms of leukemia are varied and depend on the general health status of the animal. The most common include fever, loss of appetite, weight loss, skin lesions, gastrointestinal disorders, and swelling of the lymph nodes. This is a disease caused by feline parvovirus, in some ways related to canine parvovirus. It is also known as feline distemper, enteritis, or infectious gastroenteritis. The contagion occurs from contact with the bodily fluid of an infected cat. Its most common symptoms are fever and, later on, hypothermia, vomiting, diarrhea, depression, weakness, dehydration, and anorexia. Additionally, when performing a blood test, we will discover a significant drop in white blood cells. This disease is deadly, and we need to act quickly to separate this cat from any healthy cats with which they may come in contact. The virus which causes this particular disease is a strain of the herpes virus. The virus lodges in the airways, causing infections to the respiratory system. Between 45 and 50% of respiratory diseases in cats are caused by this virus. Symptoms include fever, sneezing, nasal mucus, conjunctivitis, lacrimation, and even ulcers in the cornea. It is spread by contact with fluids such as nasal secretion and saliva. There is no specific treatment for the disease itself, only the treatment of its symptoms. The cats which heal become carriers, as although they may no longer suffer the symptoms of the disease, they continue to harbour the virus and can infect others with it. This is a very contagious respiratory disease, particularly common among stray cats who live in large groups. Symptoms include sneezing, fever, excess salivation, and, in some cases, ulcers and blisters in the mouth and on the tongue. An infected animal which manages to overcome the disease will remain a carrier for life and can still infect others. Both feline herpes virus and feline calcivirus can cause feline influenza. The most common symptoms of this respiratory disease include fever, sneezing, nasal and ocular discharge, loss of appetite, cough, depression, mouth breathing, excess salivation, and, in some cases, ulcers in the mouth. This respiratory disease is produced by bacteria which generates a series of infections known as chlamydiosis. It is spread by direct contact with fluids and bodily secretions. It is not a fatal disease in itself, however, there are potential fatal complications, so a vet's visit is a necessity to ensure correct treatment. The symptoms of feline pneumonitis are excessive tearing, conjunctivitis, reddened and painful eyelids, and abundant ocular discharge, which may be yellowish or greenish. Additionally, there may be sneezing, coughing, fever, nasal mucus, and a loss of appetite. This disease is commonly known as feline AIDS. Its transmission usually occurs during fights and during the reproductive act, as bodily fluids are exchanged from an infected to a healthy cat. The symptoms which make us suspect this disease are an absolute depression of the immune system and an increased susceptibility to secondary diseases. It is these secondary diseases which ultimately lead to the death of an affected cat. Work is being done to find a reliable vaccine, but it's hindered by developing resistance to this disease due to exposure to other infected cats. The virus which causes the disease is a coronavirus, which more commonly affects younger or older cats. Its contagion occurs most often through contact with the stool of infected cats. A healthy cat can become infected by smelling this fecal matter, and the virus gets introduced through the respiratory tract. The most notable symptoms are fever, anorexia, increase in size of the abdomen, and accumulation of fluid within it. This is because the virus attacks white blood cells, causing inflammation of the membranes in the thoracic and abdominal cavities. If it occurs in the pleura, it produces pleuritis, and if it affects the peritoneum, it produces peritonitis. There is a vaccination against this disease, but once contracted, there is no cure and is usually fatal. This is a very common problem in domestic cats, with serious consequences including a reduction in life expectancy. In general, sterilized cats usually suffer from this condition more than unsterilized cats. However, it can develop in any cat without an appropriate diet, and which leads a sedentary life. Carried out so far find that obesity in cats is related to diseases and health problems such as diabetes, respiratory failure, fatty liver, hypertension, urinary tract infections, and increased levels of bad cholesterol. This is the alteration in the function of the kidneys and is a disease which can only be controlled, not cured. In general, the kidneys are responsible for filtering and eliminating harmful substances from the body through urine. When there is a failure in this filtering system, renal failure can occur. The most well-known causes of renal failure include kidney damage from toxins or mismanaged medications, hereditary polycystic kidney disease, particularly common in Persian cats, tumours, older cats over 15 years old, and bacterial infections. The main symptoms of kidney failure in cats are loss of appetite and weight, increased thirst, increase in urination, depression, vomiting, diarrhea, pale mucous membranes, dehydration, hair loss, bad breath, and ulcers in the mouth and/or stomach. Can we prevent these diseases? Most of the conditions and health problems mentioned here are prevented by means of adequate preventive medicine based on appropriate vaccination and deworming schedules. This is why it is so important to follow these schedules in conjunction with veterinary checkups. Also, as soon as the onset of symptoms is witnessed, take your cat to the appropriate specialist. So, what do you think of today's video? Leave us your thoughts in the comments below. Don't forget to give us a like if you enjoyed the video and subscribe to our channel for more of the same. Till next time.